All right, let's get going, shall we? A couple things housekeeping wise. I just want to make sure everybody remembers that each session is only going to open up when it's ready to open up. It's set time wise, primarily to make sure that you don't progress too fast, you progress just appropriately, and you have time to let some information sink in. There is a quiz. You will have some quizzes. They're not hard, just to test your knowledge. So why don't we go ahead and start talking about infusion therapy? Because that's why we're all here, right? So, introduction. So, infusion administration and vascular access device, again, VAD, care and management require a variety of supplies and equipment, and sometimes it's often complex depending on what you're working with. Included in this is single-use devices such as disposable solution containers, tubing, the vat itself, durable medical equipment, including infusion pumps, IV poles, visualization technology such as an infrared and ultrasound. Now, I know how to use those. I've been trained on those, but I'll tell you, I've never had to. I've always been able to get my IV started or my PICC lines inserted. So I've never actually have had that problem. But anyways, they're there for you to use. You need to be well educated and competent in the clinical application and proper use of both supplies and equipment, and as well as end users should be involved in the VAD infusion product evaluation. So a lot goes into this. That knowledge base and things like that. So buckle down. We're ready for go for a ride. All right, let's talk about solution containers. So solution containers for hydration are electrolyte solutions, medications, blood products, anything is called a solution container, right? It's what holds our solution. And those containers are either made of plastic or glass. Those are the two options. Although today the use of glass containers it's very antiquated and very, very rare. We don't see it as much, but we do see it in stuff that is maybe not compatible with the plastic that is used. And then we'll put that in a glass container. So the history of sterile evacuated glass containers dates back to 1929. In 1950, plastic containers became accessible for the storage and delivery of blood products. Today, plastic containers are used most often for administering solutions and blood products. Now, I can tell you that I remember glass containers. I wasn't around in 1929, but I do remember glass containers. So they are still used today. So um, just know that the most of what we see is plastic. So a little bit about glass containers. Glass containers available in the United States are made not just of glass, but of a combination of glass, plastic, and rubber, and a little bit of metal. Because glass does not collapse, venting is required to allow air to enter into the bottle during infusion. So it has to be replaced, right? So think about it when you're drinking out of a mug, or even a bottle. You're drinking out of a bottle. You've got to have air going in to replace the volume for the solution to come out. Same thing with these glass bottles. Because they do not collapse, they're solid, there's no exchange of air and fluid. So this is why we use a vented administration set. This allows for the air to come in and out. So it goes in and out. They're also called a universal administration set because it can be used with anything. And just because has a vent on it doesn't mean it can't be used with a plastic, type of container. So again, it just depends on the container. No, you have to have a vented tube or vented infusion device and tubing with a glass bottle. However, with a plastic bottle or plastic container, you can have either or. So just make sure you know that again. I'm going to say it one more time. If you're using a glass, because it does not collapse, you need a tubing set that is vented. If you're using a plastic device, it doesn't matter. Vented or not vented, it doesn't matter. You can use either type of tubing. So just make sure you keep those straight. Okay, so here is a picture of two types of systems, and the video is off because the video obscures part of this slide. At least for me, it does. The closed glass system, and that's the picture that's labeled glass system, has a rubber type stopper. So there's a rubber type stopper, and let me see if I can. So this is your rubber type stopper right here, and it is covered with a removable seal. So once the seal is removed, you will insert this the tubing device into the bottle immediately. Okay, it gets inserted in immediately, and it is a closed system. The plastic is still immediate. It's just a little different. So with a plastic system, you have your bag. You have a spike coming from your tube, and it goes right into the bag. And again, once you uncover this spike, this becomes susceptible to germs. So you want to uncover it without touching it or anything. You're going to put it right into the bag. And again, we're going to go over all this in person. That's our full day of in person. And then, so you keep everything self-contained. And then you have a closed system as well. So a little bit different the way they work. Now, what I want to point out is this, if you notice in this tubing, you have this is a flow regulator. It's a roller clamp that regulates the flow if this is open to gravity. If this is hooked to a pump, this would be opened all the way, so then the pump would regulate the flow. However, if you're doing this in a home type of environment, then and in some clinics and things like that, and you don't have a pump, so you're setting this this drip rate based on a calculation that is done, and you regulate it by this. Now, what I want to point out is this here and this here, not all this tubing, it looks like this. A lot of our tubing has this drip chamber where we're able to see it drip. Y'all probably know what that looks like. Is usually up higher, and the roller clamp is down further. So it just varies. It depends on the type of system and what your organization uses. You would become familiar with that if you're doing this type of IV therapy where you work. So just know there's two different types of systems. One is a glass and one is a plastic. We primarily see plastic anymore. Okay. So remember we were just talking about the vented and non-vented. So here are the spikes that I was referring to. So this is a spike, and as you can see right here is a cap. This covers and protects that spike and keeps it sterile. Once that cap is removed, all sterility is thrown out the window. So you do not want to uncover this spike until it is ready to go into the bag. Okay, last thing you do. Now I can tell you the majority of nurses, that I work with, we pull it off with our teeth, which is not the best thing, and I don't recommend that. But you want to make sure that it's the last thing you remove. So, and the spike is under here. This here is your vent. Your vent is open and your vent is closed. So that's what the vent looks like. If you're using a glass system, that vent has to be opened, or you're going to have like a reverse vacuum, and this is going to start to suck in on itself. And if this is closed here, so you need to realize when you see these, you need to make sure if you're using a glass container, you've got it open. Now, another thing we want to point out is you want to make sure that you're checking your glass solution containers for clarity. To ensure the safety and the administration of solutions, the clarity of the solution and the expiration date are checked before the glass container is connected to the administration set. Now, what I do want to also say is, it doesn't matter if you're using glass or if you're using plastic, you should always get in the habit of checking them to make sure they look clear from particles. I mean, depending on the solution that you're infusing, it could be cloudy, it could be opaque, it just depends. It could be yellow, but you just want to make sure it's clear from particles. And then you want to also make sure that the expiration date is not expired. So I would like to say that I have never received something from a pharmacy that the date is not expired, but it happens. It slips by them sometimes on a rare occasion. So you always check your expiration date. Just like anything, you just hold it up and look at it. If, you can shine a flashlight through it, you're looking for floating particles, discoloration, make sure it's not contaminated. And then again, like I said, a very rare occurrence, but it needs to be reported immediately and per your organizational policy. All right. So what are some of the advantages? Well, the advantages are the glass is crystal clear, so it allows for a good visualization of the contents of that bottle. There's the graduation marks on the bottle, that tells you if you're at 50, mLs, 100 mLs, 150 mLs. They're very, very easy to read on glass. And it's inert. It has no plasticizer, so it doesn't change shape. It's inert. It doesn't move. Some of the disadvantages include it's easily broken. Glass is very easily broken. One of the reasons we moved away from it. The particulate matter it due to coring. So you could run into some particulate matter, meaning little particles, and that's why we use the filter because of the coring ability of the glass, and it's cumbersome to dispose of. They're bulky, they're large, they don't flatten. You've all seen the plastic IV bags there, and probably have gotten them infused on you or somebody and they're just very easy, pliable, easy to toss away. Plastic can commonly infuse. I'm sorry, most commonly infusate solutions are packed in a flexible and semi-rigid plastic containers. I'll show you shortly a picture of those. Flexible plastic containers have several unique features. The entire structure that comes in contact with the fluid, including the closure, is made of the same material. In the past, the most common plastic used in solution containers was PVC, polyvinyl chloride. And I'm not going to even try to pronounce this, but DEHP, it's a plasticizer, is added to the PVC to make the solution container soft and pliable. Unfortunately, DEHP is a toxin that can seep into the infusiate, and some drugs absorb or adhere to the surface of the plastic containers. This has led to many manufacturers using a PVC DEHP-free infusion container and products. So back when they started this is how they were made, and they were having a lot of reactions and toxicity and couldn't figure out why. And it was a actual pharmacist in their infinite wisdom that realized the plastic was infused with this DEHP. So they started making DEHP-free containers, which solved the problem. So most of your plastic bags now are just PVC. So here's a picture, promised you a picture of a plastic infusion bag. There's different sizes, 50 mLs, 100 mLs, all different kind of sizes. We have primary and secondary bags, so there's just more than you can imagine. Antibiotics, electrolytes, banana bags, sodium chloride, lactated ringers, all of that we'll get into, but there's a bag for everything. So plastic solution containers containing premixed solutions, for example, 0.9 sodium chloride or normal saline, 5% dextro and waters, otherwise known as D5W, are provided in 1,000 mLs and 500 ml bags for primary infusions and in 50 to 250 ml bags for secondary infusions or smaller volume primary infusions. So what we mean by that is if we have somebody that we're just infusing a large volume for whatever reason, of course, we're going to use a larger bag and that's the primary infusion. But if we're infusing a smaller amount or a secondary infusion, we would use the 50 to 250 bags. So again, all based on doctor's orders, and what they write is what we infuse. Larger plastic containers up to 4,000 mLs are available for mixing large volume infusions such as parental nutrition solutions. We see these with TPN, individuals that are on TPN, they get the very, very large bags. Plastic containers are flexible and collapse and do not need air to replace fluid flowing from the container. A non-vented administration set is used with plastic containers because they collapse as they empty. So again, they just deflate, unlike the glass where we needed the vented to replace the volume with air. Depending on the manufacturer, there are many 1 or 2 extensions or entry ports protruding from the bottom of the bag. So if there are 2 ports, if there's 2 ports, one is the administration port where we hook up our IV tubing to, and if there again is 2, you got 1 for the administration set, and then 1 is it's covered and it's protected. You may pull it off, you may not. The second is an injection port for adding the medication. So depending on if you have to drop the medication yourself or to inject it into the bag, whatever the case may be, you'll see 2 ports. A membrane seals both medication and administration ports of the container. The entry of air into the system is prevented, so you don't have to worry about contamination. Spiking the plastic container is accomplished by a simple twisting motion. So it's a pushing twisting motion, and it can be very difficult for somebody with some dexterity problems. When I was doing home infusion for years, that was our biggest issue, was getting the elderly population to be able to spike the bag, because when they spiked the bag, they had to push and twist at the same time, and their dexterity just couldn't do that. So, and you have to be careful because you could perforate the bag because the spike is pointy. But again, it was just a simple, pushing, twisting motion to spike the bag, and once the bag was spiked, they were good to go. So what are the advantages of this type of delivery system? So the plastic is a closed system. It's flexible, it's lightweight, and easier storage. Sounds like a no-brainer, right? However, there are some disadvantages. It's more easily punctured. There is a fluid level difficult to determine, composed of plasticizers, and the potential for leaching depending on the type of plastic, meaning that leaching is where byproducts of the plastic go into the solution. So there is that risk. So spiking an IV container, here's a picture of it. So as you can see, the individual here is holding the drip chamber that has the spike. They're holding the bag here. Now I can tell you from experience, it's easier to hold the bag here. However, if it's hanging, you could do it this way, but it is very simple to hold it here because it gives this support, and then you insert the spike into this port, and it's in a twisting. I've never been able to do it just by pushing it in. It's a kind of a twisting, pushing kind of motion. Here is the other port. Remember, we said there would be 2. Here is the other one where medication is entered. Now, if it's been entered by the pharmacy before you get it, they will probably have this taped off. Okay, so this will be taped. At the end of this is a rubber stopper like this one, but it would have a tab on it where you can pull it off and then put this in. So that's how that works. Semi-rigid containers. They are made of polyolefin and they contain no plasticizers. They have fluid level marks that are easier to read and are impermeable to moisture. However, semi-rigid containers crack more easily and are not as tolerant to temperature extremes. Semi-rigid containers must be vented to add air to the infusion system because they do not collapse. So what does that mean for you? Well, it just means you need to know what kind of container you're using so you know what kind of tubing to use. You do have to check the plastic containers for clarity as well. So you need to make sure you hold those up, check them for discoloration, any particles floating in there. It should be free of particles. You may need to squeeze the plastic container to look for any type of leakage. You want to check the expiration date as well to ensure patient safety, and be sure the outer wrap of the plastic system is free of pooled solutions, okay? Because you may have to actually tear open a bag to get the bag of solution out. Any abnormality should result in the return of the container and an unusual occurrence report to the pharmacy per your organizational policy. Use activated containers. These are some of my favorite. So these containers consist of a solution, for example, D5W or normal saline, such as the case of this picture, and a separate compartment with a pre-measured drug like an antibiotic. That would be this, okay? This is your diluent and this is your drug. Now, the way this works is this here gets cracked. You actually bend this in half just a little bit, or you push, like this is a push system. This bottle and this plastic cap here gets pushed up just enough to pop that seal, and you get some saline down into here. Because this is normal saline, right? If it was D5W, you'd get D5W down in here. You'll squeeze this bag just a tiny bit to get the fluid in here, and then you twist this. You don't shake it rapidly, it causes bubbles, but you invert it, you circle it around, and then you turn this whole thing upside down, and you squeeze this bag to draw this fluid out. Okay? I know that probably sounds funny, but trust me, it works. So once you get all that fluid back in here, you flip it back around. You can hang it up by the hole here, and the fluid will not come back into this bottle. You may get a drop or two, but that's okay. Here is the little plastic tabby I mentioned before that you would pull off, then spike this bag and get it ready for infusion. So these are use activated containers. You will see these a lot. They are very stable because your drug, your antibiotic, is in powder format, which has a long shelf life and is stable and does not become activated until whatever solution the pharmacist combines it, because it comes together. The pharmacist prepares this up to this, okay? So when the pharmacist prepares that, you don't have to worry about what you have to add. It's already added. You just activate it, mix it up, and then infuse it. So the syringe as the solution container. So this happens on occasion where you get a pre-filled syringe full of solution, heparin, saline. You've got those, to infuse. They're pre-filled. They're in a sterile wrap. You would unwrap them and you wouldn't push them in. Sometimes it's a heplock, and sometimes it's a bolus. So those are very commonly used for flushes and for locks. So you will get syringes that also have pain medicine in them, anti-nausea medicine in them, and that are put in an IV. So those are what we consider syringe as a solution container. Let's talk about administration sets. The tubing or administration sets are manufactured with various very well, okay, so um the tubings or the administration sets is, PVC with DHP. These historically used, not so much anymore. Now we have the non-DHP because of the um, the risk for um, toxicity. So we also use non-PVC lined tubing as well. It's a little bit more rigid, but we do use it to make sure it's everything is compatible with um, patient, however, may not be compatible with infusion pumps. So when we talk about the syringe used as a container, this is a sterile wrapped zero point 0.9 sodium syringe, sodium chloride syringe. These are what we use for our flushes. This is how it comes in a package. You tear it open, you got a cap here, you take it off, and you're good to go. So the basic components of administration sets include the spike. We've talked about the spike. It's a sharply tipped plastic, and it is designed to be inserted into the solution container. There's a flange. The flange is a plastic guard that helps prevent touch contamination during the insertion of the spike. There's the drop orifice. The drop orifice is the opening that determines the size and the shape of the fluid drop. So this is like part of what we see, what we call the part of the drip chamber. It's inside the drip chamber. And then the drip chamber is a plastic clear, and it's pliable. You can squeeze it, and you can count your drips. It's how you view those. You have the tubing. That's self-explanatory. You have the clamp. It's what I said earlier is the roller clamp. It is what regulates the flow of the fluid coming through the tubing. It can be open wide where it's just a full force, or you roll it to slow it down. You have injection ports. These are what I showed you where the pharmacist can inject the fluid. You have a back check valve. This is a one-way valve that allows the solution to flow in one direction. You have a male lure end. It's the end of the administration set that is attached to the IV catheter or the needleless connector. And you have the final filter, and it's just a filter that removes any particles that could be non-observable in the fluid. So these are our basic sets. So this is the let's start here. This is the spike. This is what goes into the bag. If you have a vent, it's right here. Then this is your drop orifice. It's what is actually dropping each drop. Then it goes into the drip chamber, down the tubing. This is the roller clamp that regulates the flow. If it's all the way down here by the wide end, it is wide open. Rolled this way, it becomes tighter and seals off this tubing. Then you've got an injection port. Okay, you may have a number of these in the tubing, but you have an injection port where you can inject, medication or whatever. You have a filter. Sometimes the filter is up here. Sometimes it's here. You may have to add it. It may be already added to the tubing. And then you have this two-piece male lure lock hub, which connects to the actual IV. So you have primary continuous administration sets, and this is a very good picture of one. The spike, the roller clamp, and then you have here, it's a little slide clamp. These are primarily used for infusion pumps. They get put into the pump, and if something is happening with that pump and it gets shut off, this will automatically be slid shut by the pump and clamp down on the line, so nothing can flow either way. These sets are available as either vented or non-vented, which you would have right here. These These are used for as a primary set, and they are a macro drip, meaning they can drop 10 to 12 drops per milliliter, or a micro drip, 60 drops per ml. And we're going to get into what all this means in a later lecture. Primary sets may have injection ports, back check valves, and often inline filters. The drop factor, meaning how fast it can drop each drop, how many drops it can drop, is specified on each package. And the administration set, as well as the accompanying literature, will have that information on there so you know. The micro drip set, also called a mini drip or a pediatric set, is used when you really need a small or very slow rate. The back check valve is a device that functions to prevent retrograde flow of the fluid. When the fluid is flowing in the proper direction or from the bag to the patient, the valve will be open. If the fluid is flowing in the wrong direction from the patient towards the solution container, the valve closes. So this way it doesn't do this, so it doesn't do that. Because what would happen is you would get this negative flow, and it would suck blood out of the patient. Not a lot, but it would be enough to clog the line. So the primary container, you can hook up a secondary administration set, otherwise known as a piggyback, and it's attached to that ejection port that we saw. Now, in order for the back check valve to work correctly, it needs to be located between the primary fluid container and the upper injection port. This prevents that secondary medication from flowing into the primary. This is all very confusing stuff. What you need to understand is that there is a proper way to hang the bags. Anymore, your pumps regulate how this works. So you have your primary bag, and your primary bag usually gets hung lower when you're not using a pump. Hangs lower because of the way the bag flows. So if you've got your secondary bag higher and it's done infusing, it's a smaller bag, so it's done infusing, gravity will automatically pull from whatever bag is lower. So that's why you want your primary bag to be lower. So this way, when that secondary bag is empty, your primary bag kicks in. This is just an example of a bag, and you can see here it tells you what you have to use. So you need the adapter. It tells you about the size. It tells you this is a 10 drop per ml approximately type of solution set. So they're always labeled. They're always labeled. We pretty much use a standard one now because the pumps regulate what we do. But back in the day when we didn't have the really nice fancy pumps, we had to base everything off of what was on this. So Infusion Nurses Society, or INS standard replace primary and secondary continuous administration sets used to administer solutions other than lipid, blood, or blood products no more frequently than every 96 hours, but at least every 7 days, unless otherwise stated in the manufacturer's directions for use, when the VAT is changed or the integrity of the product or system has been compromised. So again, you're going to change your line ideally every 96 hours to 7 days, or when it is compromised. Your secondary administration set is defined as an administration set attached to the primary administration set for a specific purpose, usually to administer medications. It is commonly known as the piggyback. It has short tubing with a standard drop factor of 10 to 20 drops per ml. These sets are widely used for the administration of multiple intermittent medications such as antibiotics. They are connected with a needleless adapter into an injection port immediately distal to the back check valve, which I just described to you. Your secondary, your piggyback, again, non-pump, is going to be hung higher than your primary bag due to gravity. That it only works in that manner. These also are going to be changed every 96 hours to 7 days, unless contaminated. So you have primary intermittent. That set is defined as an administration set that's connected and disconnected with each use. The set itself is generally the same one used for a continuous primary infusion. The set may be connected to the needleless cord of the patient's VAD with each use, or it may be connected to another primary continuous set. It is important to recognize that every connection and disconnection, there is risk for contamination at the spike, the catheter hub, the NC, and the male lower end of the administration set, potentially increasing risk for catheter-associated bloodstream infections. Because of this contamination risk, attention to the ANTT with protection of key parts is essential with each access, and careful attention is paid to protecting the male lower end of the set with a new sterile compatible covering device after each use. An example of an antimicrobial product used for this purpose is shown in the slide. Okay, this is a dual cap. It is it's an antimicrobial protection. They kind of look maybe a little bit different. You may, depending on the manufacturer. And again, it's used for a needleless system, and it keeps this line clean and free of microbes. So again, this is an example of the piggyback. So you have your primary infusion container. Your piggyback is higher, and it flows away. As it empties and there's no more left to go, this one will kick in. Your clamp has to be open. It's just the way gravity works, and it has to do with the check valve. So this comes down. Let me start over here. This comes down, will not go up into here because of this check valve. It goes down. However, when this is empty and there's nothing else, this kicks in and then goes ahead and starts infusing. Volume chamber. Used less often today due to preference for infusion pumps and syringe pumps. The volume chamber is used for intermittent administration of measured volumes of fluid with a calibrated chamber. These sets are calibrated in much smaller increments than other infusion devices, which limits the amount of solution available for infusion, usually for safety reasons. Most chambers hold 100 to 150 mLs of solution, but neonatal chambers may only hold 10 to 50. The volume-controlled set may be used for pediatric patients and critically ill patients when small, well-controlled delivery of medications or solutions is required. Don't usually use these anymore. The primary Y administration set is used for a rapid infusion or for administration of more than one solution at a time. You see these a lot in ICUs and in the ER. Each leg of the Y set is capable of being the primary set. The Y set has two separate spikes, so you can spike two bags at once with a separate drip chamber, so they each have their own drip chambers, and a short length of tubing with individual clamps. Primary Y sets are made up of large bore tubing. The purpose of this tubing is to infuse large amounts of fluids in acute situations. Okay. Use of the primary Y set is associated with the risk for air embolism because, again, the air can be drawn up quickly. This is a volume chamber. So this is what holds the volume. Very rarely used nowadays. You see these in like neonatal units and everything where this is the volume that we're infusing. So it has to be very precise, but not used often. Blood component. So blood is administered only with the administration sets specifically designed for this use. And I say that like that because these sets have to be able to hold a very viscous solution. So because blood is very viscous, but yet allow for rapid flow as needed and can provide a dual line like a Y for infusion, because you've got to be able to hook up not only the blood, but a saline, just in case something happens, you need to open that saline during the transfusion. that, I worked in a blood bank for a long time, when I first became a phlebotomist, and you have to be able to run both, and so you use these Y tubings, and they're very, very thick, big bore tubings. Uh, Normally blood, transfusions at one time were delivered via gravity, and we also now do them for accuracy with electronic pump. You do need to understand that their bore is so large that they have a large drip factor to allow for this. Now, the INS, which stands for what? Infusion Nurses Society. That's right, I heard you guys. Um, they they um they recommend changing those administration sets with the manufacturer's recommendations. However, it's usually every 12 hours. Okay, this is what those look like. So you've got two spikes here, and then and this is for the blood, and then there's it's like a filter here that the blood goes through. It comes through the jip chamber and then down into whatever it's hooked up to. Lipids, those we infuse. They're usually supplied in glass or a non-DEHP plastic container due to toxicity. Lipid-containing solutions are known to leach the DEHP from the bags and tubing made of PVC. Therefore, they must be administered through a DEHP-free administration set as well. So specialty sets, pump medication specific. The pump specific administration sets, that's a tongue twister, is made specifically for use with electronic infusion pumps, which is designed. These sets may or may not allow priming of the set outside of the pump. So basically what we're saying is if you use a specific pump, there may be a specific tubing that can only be used with that pump due to the pump's makeup, meaning that may have a certain slide clamp that has to be used, and so it's just specific to that pump. These usually are non-DEHP sets, and they still should be replaced every 6 to 12 hours or in accordance with your manufacturer's recommendation and your policy as well. But I'm willing to guarantee if you guys, any of you are working for, a hospital or a clinic and you're using infusion pumps, the tubing you use is specific to that pump. Peripheral IV catheters. So a peripheral IV catheter, or an IV, has a tip that terminates in the peripheral vasculature in any extremity, and also includes the external jugular vein and scalp veins. So you've got a peripheral IV, and what is notable is there are increasing varieties and technologies in these. The INS redefined and described 3 types of peripheral IV catheters in the 2021 standards, and those are short PIVCs. Those are an over-the-needle catheter with a hollow metal stylet needle positioned inside the catheter, generally inserted in superficial veins. There's a long PIVC, and that's inserted either superficial or deep peripheral veins and offers an option when a short PIVC is no longer enough to adequately cannulate the available vein. And then you have a midline catheter, and this is inserted into a peripheral vein in the upper arm via the basilic, cephalic, or brachial vein, with the terminal tip located at the level of the axilla in children and adults. For neonates, in addition to arm veins, midline catheters may be inserted via a scalp vein with the distal tip located in the jugular vein above the clavicle or lower extremity, which I guarantee you guys will not be doing. So this, we have 3, just need to know there are 3 types. The type you are going to mostly be working with are your short PIVCs. Okay, that's what I want you to know. When a standard While not a standard category of a PIVC, the stainless steel winged needle, often called a scalp vein needle or a butterfly, is usually indicated for obtaining blood, may be used for a single dose IV medication administration, and then promptly removed. It is not left in place due to the high risk for infiltration. Stainless steel needles are available in the following gauges. They are odd numbered, so you need just to know that. Now, what I want to say about this is, and this is our last slide as well, butterflies we will use quite a bit for drawing blood. They're one of the easiest things we have to draw blood is the butterfly. It's because it's so small. So, most often. But there is another type of IV that we use, and don't confuse that with the butterfly used to draw blood. So this is a PIVC. It is a butterfly IV, which is different than a butterfly blood withdrawal apparatus. So make sure you in your mind you distinguish between the two. All right, and that wraps it up.